Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Katie Lawrence. Thank you so much for being here, Katie.
Well, thank you for having me, Brandy. I'm delighted to be here.
Let's start by introducing yourself to the audience.
Sure, absolutely. Well, I have been in healthcare for over 20 years, and I sit on the administrative side of the industry. I have spent about 15 years in medical group operations and also do a good bit of public speaking around burnout and how do we engage employees when everyone is exhausted. I love to work with leaders on building their teams and improving team dynamics. And now I do that full-time as a consultant within the industry.
Awesome. So let's go back to the very beginning when you started your career. How did you get into healthcare?
Sure. I almost fell into healthcare by accident. I was in a new town and needed a role. And back in the late 90s, early 2000s, the way we did that was look in newspapers. There weren't really online job postings. And so found a listing for, at the time it was a chiropractic office and they needed someone at their front desk. And I thought, well, I have a college degree. I could probably do this. And went in for the interview and over about a period of 3 years, ended up working the front desk, but then training individuals, moving into a more leadership role, helping them transition from paper onto an electronic medical record and learn the revenue cycle side as well, because all of that kind of happens in one little place when it's a single provider.
Yeah. So then what happened next? How long did you stay there and where did you move next?
From there, my husband and I had moved back into the town where I had gone to college. And so I spent about 3 years at the first chiropractic office and then about another year at a new chiropractic office in the town where we had moved back to, which is actually where I live now. And about a year after working at the chiropractic office, I had the opportunity to move into a health system role. And this is really where I found my love of healthcare in general, or healthcare proper. As outside of a single provider practice, I really learned the intricacies of what a health system and the full industry are. I moved into a role as a front office supervisor. I had a team of about 7 or 8 individuals across 3 offices for a pulmonary practice within a large integrated health system.
Okay. And so what exactly did you do with that role, in that role? Like, what did your day-to-day look like?
Absolutely. My day-to-day looked like making sure all the roles were filled. So as a first-time manager, I had to really be responsible for who was calling in sick or what PTO had been, paid time off had been approved, and how are we going to juggle and make sure that phones got answered, patients got checked in, insurance got verified. So I had team members at check-in, at checkout, on the phone. So we had removed phones from either of those positions. They were in a call room. And then referral processes. So as a pulmonary office, as a specialty, we received dozens of referrals a day. And so we had someone who was dedicated to making sure that those patients got timely appointments and that the most urgent patients got the first appointments available, and that everyone got appointments with the subspecialist if there was a subspecialty need. And so really a lot of oversight, a lot of sitting in, oftentimes a frontline manager or a frontline supervisor is hopping into a role where they are both working and leading. And so oftentimes I was sitting in one of those chairs, answering phones, checking in patients, checking out patients, making sure charges got entered, because that person may have been out for the day. When there's 8 people, it's fairly rare that a whole week goes by that no one is out for any particular reason.
Yeah, it's interesting because you become all things when you're that frontline supervisor. And what
Yes.
I think what people don't understand about big hospital systems is with all of the regulations and stuff that impact our industry, you need so many positions to do all of these things. Like you said, verify insurance and, check people in, and you need different people to do all these things. So it really is a huge operation.
It is. Yes, it was much more intricate and complex than I had ever imagined. So it was a big learning curve when I started. But I spent 3 years in that role and really came to love the ins and outs of working in a medical practice and really being on the front line and seeing what it was like, and also still getting to interact with patients on a very regular basis.
And so now I know you're doing something different, and we're going to talk about that. But what was your defining point in all of this? I mean, you started out in a chiropractic office and now you're in a big hospital system. Kind of what was your thought process at that time?
Yeah, so I think the biggest leap for me, or the kind of the pivotal moment, was when I moved so I left a pulmonary office. I spent about a year and a half building a gastroenterology practice for the same health system for my same boss. I was working for the same leader. And then I had an opportunity to really work with practice managers. So I had responsibility after that to work with about 7 different medical specialties. So still the pulmonary office and the gastroenterology office, but about 5 others as well. And at that point, I was working with leaders of teams. And that to me was my shining star moment. I really came to love helping others to work through the nuances of leadership. And really most of the rest of my career, the last 15 years or so, has been around that defining point and learning to lead leaders better, learning to teach people how to lead better, because it's not a skill that we are innately born with. It is definitely a set of skills that we can develop and learn. And it's not often something that is taught. It's often a very tight combination of experience alongside strategies. So you're learning the tip and putting those things in use in a very day-to-day sort of way.
How did you learn how to lead leaders?
Yeah, I think twofold. One was we had some really amazing leadership at the health system, and they brought in a consulting team, and that team had spent their career. They had a background in counseling and psychology work. They are very much all about holistic leading, and so I learned a lot of nuances from the continuing education that our health system provided at the time. And then in pairing with that, I also got very involved in the National Organization for Medical Practice Managers. So the Medical Group Management Association, MGMA, is another large entity that really focuses on helping practice managers and health system leaders in general, but really focused on practice managers to lead better. And they bring in experts and consultants. And so those were kind of the 2 pathways that really helped me.
Okay, so going back just a little bit, with your experience in medical practices and practice management and in leadership in healthcare, what are some of the challenges that you saw with patient care, either on the patient side or on the provider side?
Yeah, I think the biggest challenge is that there's only so many hours in a day. And healthcare is run by people.
Yes.
And people aren't machines. And I think it can be really challenging to remember that from both sides. As a healthcare organization, those of us who are seeing healthcare and know the language of healthcare and understand what is routine and what is abnormal, or what is sort of on the periphery of the extreme ends of any sort of spectrum. When we see something that is normal, it can be, a normal anomaly, sort of in that range. It can be challenging to remember that for the patient, it's not anything even close to normal, that it's very much scary and unknown, and they feel bad. They physically feel ill at the time. And so remembering all of those things and keeping them top of mind can be a challenge. And then on the flip side, it can be a challenge from the patient perspective to remember that the providers and the staff and the teams are also only human and also have lives outside of the workplace and have other demands and may have family, concerns going on, or may just have a busy life, and that they don't just live and breathe their career, that it is their job, and that it's, it needs to have bounds. And so there isn't a 24/7 ability, like there is, to look something up or buy something on Amazon 24/7. You can't reach your actual physician. They do have to sleep. They do have to, participate in family activities and those sorts of things. So I think it can be difficult on both sides to remember that we're all human, and granting each other that grace is really important.
Yeah. So what do you think we do about that? Because you're right. And I love how you said it's not like Amazon where something is available 24/7 and it's at the click of a phone. And I think sometimes the public perception, for whatever reason, good or bad, is that I should be able to get this service when I want it because I need it.
Absolutely. And I think there are ways to extend our care provision as health systems or as services to our patients. So there can be evening coverage, but it's not exactly the same, right? It's understanding that overnight there will be a different type of service than there would be potentially during the day. And even during the day, if the physician is with another patient, they may not get back to you quite as quickly. And I think it's remembering that there is a desire, and that the physician wants to get back to you, right? The physician wants to care for their patients. Most physicians came into healthcare because they really desire to take care of patients, and they really do want to get back to you. Some of the burnout and frustration that I see from physicians most frequently is because they can't be all things to all people, and they really want to be. They don't want to, feel like they have, let someone down. And I think that is important for the general public to understand, is that physicians and nurses and physical therapists and caregivers of all sort really do the work that they do because they care about the people they care for.
I think that's a very good point because, like you said, we're all human. And so if we take the time to understand the other person's perspective, I think that goes a long way, because as healthcare providers, we do want to take care of our patients, and we want to take care of our families, and we want to have this life that's not just work.
Right.
And on the patient side, understanding that your doctor wants to get back to you, your doctor wants to do the right thing. But like you said, just grace on both sides.
Mm-hmm. Absolutely.
Because one thing you said that was really insightful and just thought-provoking is that, as we see things in healthcare, it becomes second nature to us that it's not as big of a deal. Yet we have to remember that to the patient, it's a big deal.
Yes.
And how and that comes across in how we deliver the message or the diagnosis, how we deliver the care to the patient, how we tell them about this test that they might need, to not just make it as nonchalant as we may think it is.
Right.
But to really understand their perspective with that.
Absolutely. I think it can be easy. For example, if we're ordering a test all day, every day, and it's the 7th time we've ordered this test, and we say, nothing to eat or drink, but the patient doesn't know for what time period, or when, what can they eat, what can they drink or not drink, can they take their meds, should they, take their medications in the morning, or should they not? We can also really, every once in a while, I will see someone who will say, use acronyms, NPO. Well, what does NPO even mean? So a patient who has never experienced that acronym doesn't know that it means don't eat or drink anything, right? So it's very important to make sure that we are communicating appropriately and setting understandable expectations for the patient. If it's normal not to hear from your specialist about a new appointment for 3 days, let the patient know that, right? Let the patient know you'll hear about your appointment in 3 days. If it's been 4, call me, but don't expect to hear anything for at least 3 days. And that way, if they do get a call in 2 days, they're pleasantly surprised. But if it's, later than that. They're not constantly worrying for the next 24 hours, 48 hours, wondering when they're going to, hear about this dramatic appointment. Because for some patients, it is very dramatic to be referred to a specialist. It means something is not within the realm of what the primary care doctor that they're normally used to seeing is capable of, or has the intricacies of knowledge around.
Yeah, that's powerful right there. Yeah, that's super powerful.
Hi, friends. I have found that when clinicians decide that it's time to leave the bedside, often it's like throwing darts at a board. They just want out and will take almost anything just to move into a non-clinical role. I have always recommended taking the time to really identify your strengths, passions, and skills, and what will fuel you so that your next role is your best role. I couldn't find a tool specifically for healthcare professionals that would provide the depth needed to get a really good career evaluation. Until now. I am so happy to recommend the Stream Ahead assessment created by Career Clinic. It's the profile that I wish I had created first. Stream Ahead is thorough, comprehensive, and frankly spot on. And yes, I have personally taken it myself. I'll share the link in the show notes section of this podcast. You can thank me later.
Okay, so now you were in a physician practice office working for a big hospital system, leading teams. You decide, hey, I want to lead leaders and really help leaders gain skills that they otherwise would not have gotten. How did you end up in your own business?
Yeah, so about a year and a half ago, I had the opportunity to leave the health system, and I worked for a small startup. I really was excited to work in another avenue of healthcare. It was an accountable care organization, which for listeners, that is a Medicare backed. So Medicare affords the opportunity for health systems and independent practices to come together around the idea of improving quality for Medicare recipients. And so this was a company that was putting in place a care model that would partner with health systems to do just that. So in particular, this accountable care organization focused on partnering pharmacists with primary care providers in order to be able to educate patients who are on multiple medications, more about their medications, helping to understand more fully what that medication was doing for the patient, with the intent of hoping to keep them out of the hospital or to make their stay in the hospital much shorter than it would be otherwise. A lot of elderly patients spend a good bit of time, unfortunately, in the hospital when they don't understand all of the chronic illnesses that are going on with them. And so I was excited about the opportunity to work with other leaders in a new way of integrating care. It's an exciting model. And I spent about a year and a half getting that model set up for a health system and a couple independent practices across South Carolina. And then my role there was completed. And I have had my own business for about 2 years now, but it was really using it just as a means of being able to reach people through speaking engagements. And about 6 months ago, decided that this is what I would do full time. I am working with small and large health systems now, helping them to optimize their operations and helping them to learn leadership skills that really help to facilitate teamwork. I love the opportunity to bring a new set of eyes, because I think that helps any group, is to bring a set of outside eyes to processes. It helps us to see what our blind spots are. I love to learn what my blind spots are, and I love to help others to come to that understanding. And a lot of the way that I like to facilitate that is through teams understanding that themselves, or coming to that understanding themselves and discovering those. It's much more powerful as well as less abrasive when the team comes to understand their own blind spots rather than somebody forcefully handing them to them, right? That's not really the way that most leaders learn. It's not the way that most adults learn, is to just have something handed to them. So it's processes and workflows and engagement around initiatives.
So when you say optimize operations, what does that mean? Can you give an example?
Sure, absolutely. So sometimes we get in the habit of doing things because we've always done them. And so there may be ways to, so we do a lot of work with electronic health records. And sometimes the way that we use an electronic health record is to do the same process that we would if it were still on paper. And so we take our method of doing something. So let's say our referral workflow. Let's say we're going to refer a patient from primary care to the cardiologist, and we use the exact same workflow on paper that we would or in the medical record that we would on paper. And so optimizing a workflow might look like, do we really need to take all of those steps? Or is the electronic medical record doing some of that tracking for us? Or are we tracking a lot of things still on paper, and the electronic medical record could be built and designed to do it for us in an automated way? So sometimes it's about leveraging the tools in front of us. Other times it's about the way that we work together as a team. So sometimes I'll come into a front office and there will be everybody doing everything, right? And, there's someone who is checking patients in, checking patients out, answering the phone, and they're trying to do it all together at the same time. And there might be 2 or 3 people kind of serving all of those functions. In some cases, that works well. In other cases, it might be better to pull the phones off of that front desk, meaning that someone who is not interacting with patients face to face is answering the phones. So that may be another type of optimization. Sometimes we have concerns or thoughts around, can any of this work be done remotely? Could some of the team members have the opportunity to work 1 day or 3 days a week or any portion of their time in a more flexible or remote environment? And would that help them to be more engaged in their work if they have kind of the opportunity to do work a little differently? And so it kind of depends on the situation, but it's all about looking at, are the ways that we are doing the work we have in front of us the most efficient, effective, and beneficial for both the patients and all of the people providing that work?
And I love that because I'm a process person. I love efficiency. And sometimes you'll hear people say, the more efficient a process gets, you're kind of eliminating jobs. You're eliminating the need for people to do that particular work because you're changing how that workflow goes. What would you say to that?
I think that all of our jobs are changing. I think AI is going to potentially have some drastic changes on each of our roles, and that's okay. I believe that there are plenty of jobs that exist today that didn't exist when I graduated from college, or even 5 or 10 years ago, and so it's about being aware that the economy is growing. There are going to be new jobs. It may not look exactly the same, but there will always be a need in healthcare for people to take care of people. There will always be a need for listening, for leading, for empathizing, for discovering what machine learning can't do, for what efficiencies can't remove. And that's providing care. Healthcare is truly about care, and that's something that is uniquely human to do. And so it may look a little different, but I do think that there are roles and ways that we can continue to be better at providing care.
Yeah, and I love that you said that. And I will add that, even if whoever's listening, the audience, is in a role that they currently love, it's never a bad idea to start developing new skills so that when the industry changes or when workflow changes, you have something else that you can do that adds value.
Absolutely.
So how do people get in touch with you, Katie?
Absolutely. So I am most active on LinkedIn. LinkedIn is my platform of choice. It is, I am listed there as Katie Murphy Lawrence. Katie Lawrence itself is not a very unique name. So Katie Murphy Lawrence, I have my maiden name in there. And then I also can be reached by email at katie.lawrence@willowstrategygroup.com. So Willow Strategy Group, Willow like the tree. And I do send out a weekly email. So for those who are not engaged in or proficient on or wanting to jump into LinkedIn and the social media, I also love to just send a weekly leadership tip and reminder by email. So that's something as well, hop on my email list. I'd love to engage with people that way as well.
Awesome. And so if people want to work with you, so if there are people who are part of organizations that want, a second set of eyes, as you said, to come in and kind of look at their processes, look at their workflows, work with their teams, what would that look like for them?
Absolutely. The first thing I always want to do is have a conversation. I would love to understand what they're looking for, what their challenges are, what's going on. I think that's the first step in anything. And so we have a brief, some people would like to do that by paper, or electronic paper, Google form. So some people like to write that out and others like to have a conversation. And so either way, those are both available I always put it in my signature of my emails. And then I also have it on my LinkedIn page as well. And so getting in touch through those two means. And so we start there with a conversation, and then we decide what the scope of the work will be. For some entities, that becomes an engagement where I'm working on improving processes alongside you. In other cases, I love to bring training and workshops to teams. I can do that in person or also via webinar. So some teams like to have a webinar version instead. And so all of those are options and ways that I can help to bring more skills in leadership to your teams. And that may be a team of frontline employees. It may be a team of leaders. And either way, I love to engage with healthcare providers and professionals on the administrative side and the clinical side, because I do believe that we can continue to get better at what we do.
Awesome. So any parting words for the audience?
I think so. I have greatly enjoyed this conversation. I would say anyone who is looking to continue or to start a career in healthcare, the world is wide open. I love this industry, and I don't know that I will ever leave it. There's just so much variety within it, and it continues to change. And it's all about caring for one another and caring for our neighbors. And that to me is the most important thing. So.
Well, thank you so much for being here, Katie. I have really enjoyed our conversation.
Thank you so much for having me, Brandy. This has been great.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.